Alberta Health has delayed the release of COVID immunity testing denial records. The access to information filings done by us here at Rebel News for documents on an Alberta Health policy of blocking doctor-ordered natural immunity tests is now 27 months overdue. We filed for the documents after hearing the story of the Byfield family and their attempts to make an informed choice about whether or not they needed the COVID vaccine at all. The family's blood work was snatched by the province, and the testing ordered by the family's doctor was denied.
So I went to my doctor and he said, sure. And he ordered the test. About a week and a half later, I get a call from our doctor and they advise me that they're unable to, that the provincial lab has rejected this test.
We need to go back to early 2021. You see, then an illness ripped through the Byfield home. Yes, those Byfields. Dad Vince, his 4 kids, and his wife were all sick, some worse than others. In fact, the illness was worse the older the afflicted Byfield was. That is, except for Grandpa Ted, who lived with Vince and his family. Grandpa Ted, who has since passed, was 93 and he was doubly vaccinated against COVID-19. Naturally, the Byfields were all but certain they had COVID. Vince just needed a doctor to confirm it. It was something Vince and his family wanted to know before they made the informed decision to be vaccinated, since at the time, and now proven in practice, an Israeli study had shown that natural immunity to COVID, the kind you get when you contract the illness and recover, is stronger, longer, and more resilient than the vaccine-induced kind. So Vince's doctor ordered the serological test for COVID-19 antibodies, and Vince went off to the local private lab for testing. And that's where things got very strange. The Central Alberta Government Lab stepped in and put a stop to the tests. They overruled Vince's doctor without ever knowing why the doctor had ordered the test in the first place. But Vince being Vince, he was determined to know his medical information, whether the vampires at the government lab liked it or not. He paid out of pocket to send his blood to the Mayo Clinic in the United States. And sure enough, the testing showed that Vince had COVID at some point. He was naturally immune.
So I have the report and it shows, lo and behold, I had COVID. And now I have antibodies in excess of 250 antibody units per milliliter. It seems to me as if AHS is going way out of its way to not have this information, A, the service available to Albertans, and B, that this information not be recorded.
Now, way back then, I reached out to Alberta Health Services, and a spokesperson told me that antibody testing was not available for Albertans unless the test is specifically okayed by the government on a case-by-case basis. They told me this sort of testing is only used for surveillance purposes. So I wanted to know why. Why does the Alberta government not want us to have this information? And why isn't this policy of denying serological COVID antibody testing being conveyed to the public and to the doctors ordering the tests? And if antibody testing is used for surveillance, then why wasn't the government trying to collect as much data on COVID recovery rates as possible, right? In fact, Albertans were so curious about their own health that private testing facilities opened up, and people like me were paying out of pocket for information about their COVID immunity that their doctors could have ordered, but the province wasn't letting the doctors do it. Anyway, I wanted the internal records from Alberta Health about how and why this policy of overruling doctors came to be. And now, just now, 27 months later, I have a response, but I don't have any records. Look at this. Here's what I asked for. I asked the government to provide copies of documents presenting orders, directives, instructions, and email or correspondence discussion to Dr. Dina Hinshaw, the Chief Public Health Officer at the time, regarding if and when COVID antibody testing and or COVID serology testing should be done and what is done with the results. For example, are the results reported? Are they provided to the patient? And the date range that I asked for was from December 1st, 2020 to February 1st, 2021. Now, this is what recently came back to me 27 months later. And I should add, with no extension taken by the bureaucrats who should have promptly provided these documents to me back in 2021. They say, "We do apologize for the delay in responding to your request and appreciate your patience." Who said I was patient? However, please advise if you would still like us to continue to process this request. I am still pursuing these records, rest assured. Now, you can offset my filing costs at rebelinvestigates.com, and thank you to everybody who already contributed to my efforts to get my hands on these documents. You see, I want to hold the decision makers accountable for denying Albertans access to medical information about themselves that would have helped them make informed choices for themselves and their families. If people had truly known how many of us were naturally immune to COVID-19, how many of us had the disease and hardly even noticed, the house built on fear control and vaccine company profits would have fallen apart much, much earlier. And 4 years later, the cover-up still persists. For Rebel News, I'm Sheila Gunn Reid. If you would like to help me in my efforts to get access to this hidden policy and the records related to it, please consider making a donation at our special investigations website, rebelinvestigates.com. As you know, we'll never take a penny from Justin Trudeau, and how could we ever hold the government to account if we did? Thank you in advance to everybody who donates to make this important work possible.